Hello everyone, I'm Mr. Wong. I know that many people have problems and concerns with shoulder and neck pain and discomfort. When it comes to shoulder and neck pain, people often consider or believe that acupuncture, cupping, massage, or taking medication is the way to go, or other traditional methods. The stereotype is that if you have neck pain, you should get a massage, but that's a common misconception. I believe most of you have already tried all the treatment options and remedies available on the market, whether it's cupping, massage, acupuncture, or medication, and therapies. Using needles or ointments might seem effective, but why does this issue persist? There are 4 reasons. Aging causes calcium loss, leading to head tilting and nerve pressure. Office work often results in head leaning, which strains the spine. This tilt compresses the front joints and stretches the back. Fascia, which connects muscles to joints, gets compressed, causing muscle tension. Tight areas restrict blood flow, leading to soreness over time. It's unavoidable that we extend our heads forward, especially for those in office jobs or white-collar positions. We often find ourselves staring at computer screens, which causes our heads to lean forward. This leads to strain on our cervical spine. When our cervical spine tilts forward like this, the joints in the front get compressed while the back gets stretched. There are many muscles and nerves in the back, which we refer to as fascia. If you've ever bought pork, lean meat, or ribs, you might have noticed a white layer on the outside. That's the fascia, which is essentially the nerves of the muscles. Every muscle connects to our joints, and that's the fascia. When it gets compressed, your fascia gets pulled, which causes your muscles to tense up. When your muscles are tense, you can see it clearly. For example, when we clench our fist tightly, some areas turn white while others turn red. The tight areas are where blood flow is restricted, and over time, that leads to soreness. Why? Because of lack of oxygen. When your muscles are deprived of oxygen for a long time, they contract and tighten, almost like being overheated, like carrying a heavy stone all day. That's what cervical spondylosis feels like. As I mentioned earlier, the second reason is work-related issues, which include truck driving or street vendors cooking. Of course, if you do this for just a month or 2, you might not feel any issues, but if it continues for 4, 5, or even 6 or 7 years, you're definitely going to feel soreness. Traditional Chinese medicine practitioners often attribute shoulder pain to frozen shoulder, claiming they can diagnose it by sight. They might also mention bone spurs. However, not all shoulder pain is due to these issues. The real cause is often muscle tension from cervical spine misalignment, leading to tight muscles. Additionally, many people feel exhausted after work or study and prefer to rest their head on a small pillow. You might be thinking about using that ointment because you believe your shoulder pain is due to frozen shoulder, but that's not right. The muscle soreness is actually caused by misalignment of the cervical spine, which leads to long-term strain and muscle tension. The third reason is that many people come home feeling exhausted from work or studying. You really like to put a small pillow here and lean your head against it. Gen Z is playing on her phone, Gen Z is watching TV, and Gen Z is playing on her phone with her head tilted for a long time, which causes her cervical spine to become straight. At first, there might not be any issues, but if you keep this up for a long time, like a month or 2, you're definitely going to experience shoulder and neck pain. Even elementary school students can develop cervical spondylosis because they're not made of iron. Pillows are not medical devices and can't fix cervical spine misalignment, which causes pain. Using 2 pillows can disrupt the neck's curve, leading to cervical spondylosis. Finger numbness, that's impossible. The last point is that some people sleep with 2 layers of pillows. Why is that a problem? Okay, as we've discussed, our cervical spine has a natural curve. From the first vertebra, which we call C1, to the last one, there's a curvature. If you stack 2 pillows, it can push your neck straight. While having 2 pillows might make it easier to breathe and sleep better, if the pillows are too high for a long time, they can push your cervical spine forward, leading to cervical spondylosis. Once your cervical spine is misaligned, it doesn't matter how good or well-shaped your pillow is, it won't help. Once it's misaligned, okay? It's not something that can just be fixed over time. You can't just say, oh, let me help you fix it. You can ask anyone around you who suffers from severe cervical spondylosis, and they'll tell you that after consulting some so-called masters, they still feel the same. Did they really get to the root of the problem? Most people will say no. And even if they didn't get to the root, they might end up with numbness in their fingers. Why does that happen? Because when the bones collide, it causes blood to pool in that area. Your muscle soreness is due to muscle strain and tension, which slows down blood flow. When blood flow is slow, muscles become oxygen deprived. So when you create tension in those muscles, they can feel like they're in a drought. And then suddenly, it's like a rainstorm hits them. It's a shock to the system. Wow, it's so cool. Thank you, Master, thank you. I'm grateful. Why does it feel tight? After I get home and take a shower, it's because our blood oxygen levels get depleted within 4 to 8 hours. Your cervical spine is still misaligned. It doesn't have the proper curve, and the joints are leaning forward. So, if your muscles are being pulled for a long time, they remain tense, which leads to a lack of oxygen and soreness. After a few days, you might go back to those masters and say, oh master, I'm sore again. Why am I sore again? Usually, it's on one side. Multiple visits are needed for help. Cracking sounds like bones colliding, similar to a boxer twisting fingers. It can feel stiff with swelling and excitement. Lack of oxygen on one side makes the other feel safe. Continuous twisting prompts immune repair, thickening calcium and protein until they press nerves. Bone collision leads to repair. forming bone spurs. When oxygen is low and you twist, the other side feels safe, offering temporary relief. Continuous twisting prompts the immune system to repair calcium and protein, thickening them until they press on nerves, causing numbness, especially at night. Bone collisions lead to repair, forming bone spurs. Some use gua sha to. When it gets thick enough to press against the nearby nerves, your fingers will start to feel numb. At night when you're sleeping, your hands can feel very numb. Collision of bones will lead to repair layer upon layer until it becomes thicker and thicker, eventually turning into bone spurs. Some people use gua sha boards to stimulate blood flow, thinking it helps. However, the immune system sees the area as injured and tries to repair it, giving temporary relief. Muscles feel relaxed due to sudden oxygen influx, but there are after effects. This is common with gua sha and bone adjustments. Many women scrape their skin, leading to more tissue growth. The immune system creates more tissue, potentially causing a buffalo hump. Acupuncture treats symptoms, not the root cause. It can't realign a misaligned cervical spine. Similarly, a dislocated joint won't heal with acupuncture or ointments alone. Because your immune system thinks it shouldn't give you too much space to rub against and grow tissue, it tries to protect your joints, which can lead to a condition known as a buffalo hump. That's not a good thing. However, acupuncture only treats the symptoms and not the root cause. When your cervical spine is misaligned, acupuncture cannot correct the bones. It's impossible for it to realign your spine. It just won't happen. If you dislocate your foot while playing badminton, accidentally dislocate it while playing basketball, and you don't correct it but instead go for acupuncture, apply ointments, or take some extremely potent medicine, do you really think your dislocated joint will heal on its own? For instance, naturally. Everyone knows this, and it's something elementary school kids would answer. It's impossible. If you don't correct it in a day, your joints will be inflamed and you'll feel pain every day. So, is there any way to cure it completely? If your condition is severe, to be honest, there are only two methods, and there's no third option. Long-term neck pain and numbness can lead to a stroke. If you don't address it in time, it could be life-threatening. The first method is surgery with metal plates and screws prevents joint compression, affecting muscles and nerves. It's risky due to cervical spine nerve pathways. Even if successful, avoid falls. Physical therapy, not cupping or massage, is often misunderstood. Visit a hospital or clinic in Singapore for rope-assisted stretching. Recovery takes time, needing weekly sessions for 1 to 3 years. The cervical spine has a lot of nerve pathways, and the risks are very high. Even if the surgery is successful, you can't afford any accidents afterward. If you fall in the bathroom or twist your joints, it can be very dangerous. The second method is physical therapy. Physical therapy is not cupping, acupuncture, massage, or applying ointments. Many people misunderstand what physical therapy is. You can go to a rehabilitation hospital, a central hospital, or a body clinic in Singapore. They have physical therapy that uses a rope to help stretch you. This can lead to a complete recovery, but it requires a significantly long period of time. This means you need to go for stretching sessions once a week for 1 to 3 years, because physical therapy can't just be done 2 or 3 times and expect your bones to heal on their own. It's impossible, because physical therapy requires 30 to 50 sessions to see gradual improvement, stretching your spinal joints back to their original curvature without compressing them. Going to the hospital can be quite troublesome, and of course, it can be a bit expensive. The most annoying part is that it's quite a hassle, because every day you need to go. You can't just think about going once every 6 months and then skip 2 months. It's like all the effort you put into this treatment was for nothing. This treatment isn't just about the pillow, it's not meant for sleeping. I suggest everyone follow the schedule I give you for stretching. You should stretch once in the morning and once at night. It's not meant for sleeping. Stretching every day at the hospital and stretching at home, doing it every day is definitely more effective than just once a week, right? Plus, doing it at home, once in the morning and once at night, it's really convenient. No need for that. We have appointments. The key point is that you don't have to pay every day. You indeed need to come regularly for adjustments, and if you want to do physical therapy, you should sign up for a package of 20 or 30 sessions. Signing up for a package is more cost effective and you can avoid all those daily payments. This is very scientific. When your cervical spine is misaligned, you need to rely on a device to help stretch it. The softness and hardness of this device are just right. It won't cause your cervical spine to resist, which is very important. Also, its curvature is precisely designed to correct our cervical spine. When our cervical spine is misaligned, lying down can cause your joints to pull. For example, if we consider the joints as 1, 2, 3, 4, 5, 6, 7, and you stretch your cervical spine like this every day, lying down uses the weight of your head to help stretch your cervical spine. Your body will press down on your T2, which is the second thoracic vertebra. When you push it up, it will help bring your cervical spine back to its original curve. The first time you stretch, it might bounce back a bit. The second time, it should bounce back even more. The third, fourth, or fifth time, around 20 times or so, your cervical spine will start to have a curve instead of being compressed and pulled. After stretching about 20 times, your joints will be opened up, and when the joints aren't compressed, blood circulation improves, which relaxes the muscles. I hope my explanation helps you understand clearly. If you need more detailed information, feel free to contact me at the WhatsApp number below.